Well, some hospitals in Ontario are being forced to conserve and share epidural supplies amid a current global shortage.
So for more on this, we're joined live now by Dr. Constance Nasello for the Ontario Society of Obstetricians and Gynaecologists. Dr. Nasello, thanks for joining us. Look, I'm a mother to 3 boys. I must say, even as a journalist, I'm supposed to remain impartial, but I'm a fan of the epidural. It was so important for me to pretty much survive childbirth. How big of a problem is this, given that, you know, women are pregnant, they can't really control the timing of when their babies come out?
That's absolutely true. And part of the problem is that we only started hearing about this from some of our smaller hospitals that are doing deliveries about a week ago. Apparently it is part of the issue is that medical devices like epidural catheters don't have the same warning triggers that medications do. So people are finding out when they go to put their routine orders in. And so in these days of just-in-time delivery, people are finding out when they're down to their last remaining week or 2 of supplies. So it is a major problem.
So when it says here they're being forced to conserve and share epidural supplies, could you sort of explain a bit to our audience what that means? I mean, clearly you don't mean that just going from one bed to the next in a labor ward, but what does that actually mean?
Well, what it actually means for labor and delivery is that some of our hospitals across the country have actually developed or stratified women in labor for priority to get epidurals, which is not ideal. So, like the woman in her first labor or someone who's being induced or after a cesarean, they're having a trial of labor after a cesarean section. Or they've got a twin or multiple gestation pregnancy. So those are the people they're looking at prioritizing. At the moment, I'm not hearing that the individual hospitals yet are doing that. They're developing policies. But it's an issue also not only for obstetrics, but for all of surgery. Because epidural catheters are used for almost every abdominal surgery, gynecologic surgery, and thoracic surgery, at least in some of the bigger facilities. But it doesn't end there. I've also heard that they use the same catheters for some palliative care patients as well. So this is a big deal. And I've also heard from other places across Canada that they've been able to cobble together some sort of a catheter from existing other supplies. So that may be a bit of an issue. However, it's actually easier for smaller facilities to kind of get that thing sorted out and move forward than it is for some of the big hospitals, because there are so many levels of bureaucracy. I'm hearing that my colleagues in some of the teaching centers haven't even heard about this. Wow. We got a notice yesterday about the Canadian Anesthesia Society's statement, and I don't know if you've seen that, but they're working on it.
Right. Dr. Nasello, we only have a few seconds left, but what's the message to women who are pregnant right now, who are planning, who have it in their birth plan that they want an epidural? Should they be seeking counsel with a midwife to prepare for, hypnobirths, water births? Is it this severe yet?
Well, I can tell you that there's not a lot of experience across obstetrics these days, because in most of the large hospitals, 80 to 85% of deliveries are done with epidurals. Wow. In the smaller rural hospitals, we might be looking at 50 to 70, and they may have other means of anesthesia that are more effective. But my new colleagues, the new nursing staff, especially that have come on since COVID, new midwives, really haven't done many deliveries without epidurals. Right. So it's going to be a learning curve. Absolutely.
For sure. All right, Dr. Constance Nasello for the Ontario Society of Obstetricians and Gynaecologists. Appreciate your time this afternoon. Thank you.
Thanks, Doctor.
And thank you very much, Nick and Jennifer.
Okay.